In part 2 of symptomatology, we have discussed in detail about symptoms of mind. In this part, we will discuss in detail about classification and different types of symptoms with example. We have seen classification of symptoms in part 1 of symptomatology. We have discussed in detail about symptoms of mind in part 2. Now we will discuss remaining part of classification, that is physical symptoms, and subclassification of these symptoms, that is what are general symptoms, what are particular symptoms, what are common and characteristic symptoms, and different types of symptoms. First we will learn about general symptoms. General symptoms depict an individual as a whole at the level of mind or body. They are either mental generals or physical generals. Symptoms of mind are always general. Any sensation or modality which is experienced in more than two locations is considered as general. Say for example, you are experiencing burning in soles, burning in stomach, burning in eyes. Here, burning can be raised at the level of physical general. We have already discussed about mental generals in part 2. Now we will discuss another category of general symptom, that is physical generals. So physical general symptoms are symptoms pertaining to I and not my. Patient says I am hungry, I am sweating, I am feeling cold, or I have a fever. All reaction to physical environment are usually physical general. Say for example, aggravation from exposure to sun or exposure to rain, etc. While another example is amelioration in open air, amelioration at seashore, etc. Bonning Hussain was primarily interested in finding out the factors in the physical environment which led to illness and which brought on the exacerbation and amelioration in the course of illness. He gave a lot of importance to physical general symptoms. There are different physical generals like appetite, thirst, cravings and aversions, aggravations and ameliorations in general, physiological discharges, your sexual habits and sleep, etc. We will see them one by one. If we talk about appetite and thirst, then your normal appetite and thirst and alterations in appetite and thirst during any complaint like thirstlessness, decrease or increased appetite are classified as physical generals. All your cravings and aversions, like say for example, craving for milk, craving for salt, aversion to sweets, aversion to lemons or fruits, are classified as physical generals. Aggravations and amelioration in general, like few patients says, all complaints get aggravated during full moon or new moon. Few says they feel better in open air. So these aggravations and ameliorations in general are classified as physical general. Physiological discharges like perspiration, menses, urine, stool, leukorrhea are classified as physical general symptoms. Whenever there is alteration in normal physiological discharges, then they are classified under physical particular symptom. For example, normal menses or menstrual cycle is classified as physical general, but the moment you find any complaint related to menses, then your menstrual cycle or menses becomes physical particular. For example, menorrhagia, metrorrhagia, oligomenorrhea, or menometrorrhagia are classified under physical particular symptom. Another example of physiological discharges is urination and stool. The moment there is alteration in urine and stool because of underlying pathology, for example, extreme heart stools or blood in urine because of underlying pathology, is classified under physical particular symptoms. Next is aggravation and amelioration related to menstruation, pregnancy and climactic period. It's classified as physical general. Say for example, few females feel bloated or heavy before menstruation. So these sensations are classified as physical generals. Next comes your sleep. Any aggravations or ameliorations in general during sleep, your nature of sleep, position of sleep are classified as physical general. Say for example, disturbed sleep, sleepiness. Then different positions during sleep like niches position, prone position, supine position, etc. So these factors are classified as physical generals. Next comes your sexual affections or sexual habits. Increase or decrease sexual desires, unless related to any disease condition, are classified as physical general. Further classification of physical symptoms is particular symptoms. So particular symptoms belong to some part, and to describe this symptom, patient uses word my. For example, my head is aching, or there is pain in my right knee joint, etc. Usually, particular symptoms are found more in acute complaints. Peculiar characteristic particulars helps in quick prescription, but particulars have lesser value over generals. Only 3-mark particulars can be placed above weak generals. Examples of particular symptoms are pain in right shoulder joint or swelling in left eye, etc. Further subclassification of mental general, physical general and physical particular symptoms is common and characteristic. First, we will see what are common symptoms. So common symptoms are symptoms which are experienced by large number of patients or provers, and usually common symptoms belongs to diagnostic group of symptoms. Hence, they have little value in selection of remedy. Example of common symptoms is swelling and pain in joint in osteoarthritis or rheumatoid arthritis, or fever and pain in right iliac fossa in appendicitis. So here we can see these are diagnostic group of symptoms, hence they have little value in selection of remedy. But we can use common symptoms only when there is lack or no availability of characteristic symptom in your case. Next is characteristic symptoms. So characteristic symptoms are the symptoms which do not find a ready explanation on the basis of a diagnosis of the disease. Common symptoms with higher intensity can become characteristic symptoms. For example, we all know pain is a common symptom of appendicitis. But if the intensity of pain is very severe, then that pain becomes characteristic symptom. So intensity is very important to make common symptom a characteristic symptom. Characteristic symptoms are peculiar, rare, strange symptoms, and they rank high in selection of the remedy. There are some examples of characteristic symptom like burning sensation is better by drinking hot water. Joint pain after injury is better by tight bandaging, or cough is better by drinking cold water. There are different types of symptoms like subjective, objective, incomplete and complete symptoms, keynote symptoms, concomitant symptoms, pathognomic symptoms, negative general symptoms, acute and chronic symptoms, pathological generals, alternating symptoms. There are many more, but these are commonly found in practice. Now we will learn each symptom one by one. So first one is subjective symptom. Subjective symptom is the symptom which is felt by the patient alone. For example, throbbing type of pain in head. Here, the character of pain, that is throbbing, can only be sensed by the patient. Therefore, it is said that subjective symptoms are individualistic symptoms. The deviation and alterations at the level of sensations and function indicative of primitive stage of the disease which the patient alone can feel. For example, few patients can sense that they are going to suffer from some complaint. During this phase, they sense general exhaustion or irritability or some other form of discomfort. These peculiar sensations are subjective, hence they are of greater importance. Subjective symptoms are of great importance as they belong to individual and differ from individual to individual. For example, you have 5 cases of headache and it usually happens that character of head pain is different in different case. Like someone will say he has throbbing type of pain, other will say burning type of pain, third one will say shooting type of pain, etc. Here I have given some examples of subjective symptoms of different remedies. So first one is Arnica montana. In Arnica you get sore, lame, bruised feeling. So here soreness or lameness or bruised is a subjective sensation or a subjective symptom. In arsenic album, you get burning in different parts like burning in eyes, burning in stomach, burning in extremities. So burning becomes a subjective symptom. All sensation as if is classified as subjective. Next type of symptoms are objective symptoms. Objective symptoms are just opposite of subjective symptoms. Subjective symptoms are felt only by the patient, while objective symptoms are those which are observed by the attendants, relatives of the patient, and by the physician himself. Objective symptoms helps in diagnosis of the case. They also help where subjective and characteristic symptoms are missing, and they also help in pediatric cases where physician has to rely more on observations. There are different types of objective symptom. For example, flushed face, intense redness of the inflamed part, or dilated pupils. I have given some examples of objective symptoms of two remedies. First one is belladonna. So these are the objective findings of different parts of that particular remedy. So in belladonna, you might observe that face is bluish red, pupils are dilated, tongue is strawberry-like, tonsils are enlarged. In Natramur, you will find individuals are lean thin, their face is oily, greasy, while tongue is mapped-like. Next type of symptom is a complete and incomplete symptoms. Complete symptom is the symptom which has all three or four component of symptom, that is location, sensation, modality and concomitant. Even if concomitant is missing and only location, sensation and modality is present, we can call that symptom as a complete symptom. I have taken one example of complete symptom. In location, head right sided, under sensation column, character of pain is throbbing type. There is a lot of heaviness in head. Modalities are pain is getting aggravated after exposure to light, and pain is ameliorated by tight bandaging and rest. So here we can see location, sensation and modality is present. So this symptom becomes a complete symptom. While in incomplete symptom, one of the component of symptom is missing. Either location is missing, sensation is missing or modality is missing. For example, pain in left eye with lot of lacrimation with lot of redness. So here we can see that location and sensation is present but modality is absent. So this symptom becomes an incomplete symptom. Next type of symptoms are concomitant symptoms. Concomitant symptoms are very important from the standpoint of remedy selection. If concomitant symptoms are present in your case, your prescription should cover that particular concomitant symptom. Bonninghausen was the first one to realize the importance of concomitant symptoms. So now let's see what are concomitant symptoms. So symptoms that accompany the chief complaint and they have only time relation with the chief complaint. They bear no other or any pathophysiological relation with the chief complaint. They cannot be explained on the basis of diagnosis as they represent the individual reactions of the patient. They are based on the inherent constitutional differences and they tend to remain constant with the patient irrespective of the nature of the disease. And mental concomitants are of immense value in physical complaints, while the physical concomitants assume the great importance in mental complaints. Mental concomitant in physical ailment and physical concomitant in mental ailment are an unfailing guide to similimum. H. A. Roberts says concomitant symptom as to the totality what the condition of aggravation and amelioration is to the single symptom. It is the differentiating factor. So as we all know, whenever we have location, sensation and modality, modality assumes the highest place. So whenever you have concomitant symptom available with you, the highest importance should be given to concomitant symptoms. I have given an example of concomitant symptom: abdominal pain with pressure on top of the head. So patient will say that whenever there is pain in abdomen, at the same time I feel there is lot of pressure on top of my head. So here we can see that there is only time relation and there is no pathophysiological relationship with abdominal pain and head pain. So this concomitant symptom is very important and your remedy should cover that particular symptom. Another type of symptoms are pathognomic symptoms. Pathognomic symptoms are common symptoms of the disease that appears in every proving and are usually important for the diagnosis. For example, in tonsillitis, you get enlarged tonsils with lot of redness. In jaundice, you get yellow discoloration of sclera, yellow discoloration of skin, yellow urine, etc. So, these symptoms belong to diagnostic group. They help you in diagnosing the case and they help you in prescription where there is lack of subjective symptoms or lack of characteristic symptoms. Another type of symptom is eliminating symptom. Eliminating symptom is a symptom because of which a large number of remedies gets eliminated at one stroke or at one time, and hence such symptoms are called as eliminating symptoms. Usually these symptoms are used first in repertorization and these symptoms indicates only few remedies. For example, burning sensation is ameliorated by hot application and you will get very few remedies like arsenic. Another example is extreme coldness of extremities with high fever. Again, you will get hardly few remedies like sepia and nux moscata. Another type of symptoms are negative general symptoms. So negative generals are nothing but the absence of an expected feature of case under study. Here, care should be taken that while determining the negative generals, absence of a symptom from case record should not be perceived as the symptom in question is absent. Perhaps symptom has not been elicited. For example, patient of asthma or rheumatoid arthritis is not aggravated in damp or cold weather. Peculiar feature of case and will exclude remedy like Rustox and Dulcamara. I have given few examples of negative generals like fever without thirst, coldness with an aversion to cover, painlessness in tonsillitis, etc. Another type of symptoms are keynote symptoms. They are very important and if you have keynote symptoms available in your case, they help you in prescription. Keynote symptoms are Allen's three-legged tool. These are group of three characteristic symptoms. Characteristic symptoms that points out unmistakably to a small group of remedies. They rarely indicate the single remedy. Example of keynote symptom is restlessness, weakness and unquenchable thirst is a keynote of arsenicum album. Another example is coldness of extremities, extreme dryness and sleepiness is a keynote of nux moscata. Another type of symptoms are acute symptoms. In acute complaints, physical particular dominates the disease picture. General constitutional symptoms associated with chronic trouble recede and or if at all present in very mild form. We will have to choose the remedy based on the acute totality. Say for example, you had outside food and suddenly starts with diarrhea, nausea and vomiting. So here diarrhea and vomiting becomes acute symptoms. Here I have given examples of acute symptoms of two remedies. So first one is argentum nitricum. Here diarrhea sets in when getting ready for church or opera. Here diarrhea is an acute symptom. while in glonium you get headache after haircut, after exposure to light, or after exposure to heat. Another type of symptoms are pathological general symptoms. They are first given by Dr. Boger, and he has given lot of importance to these symptoms. So pathological generals are certain general tendencies of the tissue and propensity to certain type of abnormal changes. So from following points you can identify pathological generals. So first one is structural alterations in tissues, organs and system pertaining to man as a whole. Another point is structural alterations in a part, region, area or location when interpreted in larger context of underlying generalized disturbance, physiopathological and or miasmatic. A pathological particular is thus raised to the level of pathological general. For example, wart or eczematous wart. Another point is structural alterations to two or more location. For example, discharges, acridity, excoriations, redness, fissures, etc. For example, if your nasal discharge is acrid, your urine is acrid, your stools are acrid, your menses are acrid, your leukorrhea is acrid. So your all discharges are acrid, then you can raise acridity at the level of pathological general. Another point is discharges, their color, odor, consistency, stains, fast or not. For example, offensive urine, offensive menses, offensive perspiration. So if all discharges are offensive, we can raise offensiveness at the level of pathological general. I have given examples of pathological general from General Analysis written by Dr. C.M. Boger. So in blood, sepsis, calculi, atheroma, cyst, hemorrhages, bloody discharges, warts, ulceration, whiteness, yellow, all these are different examples of pathological general. In BBCR repertory, you will get a lot of pathological general in chapter sensation and complaints in general. I have given an example of cases where you get acridity of all discharges, offensiveness of all discharges, and color of most of the discharges is black. So we can raise acridity, offensiveness and blackish as a color at the level of pathological general. Another type of symptoms are alternating symptoms, where two groups of symptoms which keep alternating with each other. If one symptom is present, other symptom will not be exhibited. It usually indicates alternating group of remedies. For example, Rustox and Bryonia in typhoid. So far we have discussed about symptoms. Now we will discuss about signs. So signs are observable characteristics which are found during clinical examination. Signs are of very great importance when it comes to prescribing to infants, unconscious patients, demented patients, uncommunicative patients and animals. Signs which are of non-diagnostic type are of great importance in prescribing. There are some examples of signs like Cullen sign, trail sign, etc. While butterfly pigmentation on face is an indicative of sepia, while emaciation of neck is found in natrium use. Thank you for watching the video. I hope you liked the content.